Welcome to Shop Talk, presented by Show Chic, where they always put the rider in first place.
Thank you all for coming. So appreciate your support. I'm Martels, the expert on
equine asthma. We're going to talk about asthma today. Thank you, Michelle. My distinct pleasure to be here. So welcome. I first want to say thank you for taking time out of your day. I think Michelle does an amazing job to put these together. And we should always take advantage of learning, especially when we are so passionate about our horses every day. It's easy to get in our silo and do what we've always done because it's how we've always done it. And so any opportunity to hear from someone, learn something new, share our experiences back and forth is always a great opportunity. And I'm going to ask from you today that you share with me as well. So we're going to make this a two-way conversation. It'll be engaging. I hope you'll have lots of questions. I hope we'll have lots of good discussion. Because I like to learn while I'm here too. So just a little bit about who I am and how I got here. My name is Dr. Lisa Kostenduff, and I am a veterinarian. I work for Boehringer Ingelheim, and it's a German pharmaceutical company. I work in our global marketing team. Michelle asked me last year if I would come and pick a topic and share my information with you at Show Chic, and I'm delighted to be here today. I told you I work for a company called Boehringer Ingelheim, and I'll share with you a little secret. When you become an employee at Boehringer Ingelheim, the very first thing you do is learn how to say the company name. So, because it's spelled Boehringer-Ingelheim.
Could you just say it again?
Okay, so we're all going to say it together. It's burr like you're cold. Burr. Ringer like your phone. Ringer. Ingelheim. Boehringer Ingelheim. So now you are experts in the phonetics of the company name. The company is based in Ingelheim, Germany. It's a privately owned company that's one of the largest pharmaceutical companies globally. We do both human health and animal health. Still privately held by the Boehringer family. So a company was started in 1845, so a long time ago. But the exciting thing for us is that we spend a lot of time developing and researching medications for horses. And our goal is that we produce medications that keep horses healthy. And so whether those are preventive medications like vaccines and dewormers, or whether they're treatment medications like GastroGuard and UlcerGuard and Legend, those are all products that we make. And we're really, really excited and really, really proud of the work we do, because our goal is to keep your horses and help you to keep your horses healthy every single day, no matter what job they have. Whether they're our pasture pet or whether they're planning to go to Tokyo this year, they're all equally important in our hearts. And so our job is to keep them healthy and to work with you to do that. So we picked a topic today, equine asthma. Anybody here have asthma? Okay, I also have asthma. So there's a few of us that have asthma. Anybody who has a horse that has asthma? Okay, a few of us. So there's some of us that don't have asthma, and there's some of us that look like they're young and energetic. So we're going to have a little task at hand. So we want those of you that feel young and energetic to take a straw. Yeah, some are more energetic than others. I want you to all take a straw and pass it, so just one straw. Can you get one out?
You can go pass them out.
There you go. Do you want to pass them out for me, Ruby?
Yeah.
That'd be a great idea. Awesome. Okay, so Ruby's going to pass out all the straws. And we're going to experience what it's like to have asthma. Because asthma in people is slightly different than it is in horses. But in both situations, it limits our ability to breathe. So for all of us, we breathe every day. We don't really think about it. Take nice deep breaths in. You can take nice deep breaths out, exhale. Horses, if we want to breathe in, we can force ourselves to breathe in a nice deep breath, right? Everybody breathe in a nice deep breath. Okay, horses can't do that. You can't ask them, please take a deep breath now. Well, you can ask all you want, but you probably won't get a very good response. So it's one of the biggest challenges that we have when we want to treat horses for respiratory disease in any way, because they can't do that. Thank you, Ruby. Okay, so for everybody who feels really energetic, right? You're going to take a deep breath, and you're going to stand up. If you don't feel energetic enough to stand up, that's okay. Okay. So now I want you to march on the spot. And take a deep breath in while you're marching on the spot. Nice fresh breath, right? Okay, now I want you to put the straw in your mouth and breathe through the straw. Keep marching. And now breathe through the straw and plug your nose. And now kink the straw and plug your nose and breathe through the straw and keep marching. Okay, now everybody stop before we all pass out and sit down. So what you experienced is something that's a little bit similar to a person or a horse with asthma. The difficulty to breathe because the airway is constricted. So if you want to talk about what equine asthma is an inflammatory disease. It's caused by inflammation in the lower airway. It's not an upper airway disease. It's in the lungs. And the inflammation restricts the airways in ways that they can't exchange and they can't draw in air effectively anymore. And so we get reduced lung function in those horses. Now, equine asthma is a relatively new term. So I asked you if you had horses that had asthma. If I turned that around and said, how many of you have ever had a horse with heaves? Okay, or COPD. Okay, very interesting. A lot more hands went up when I said, have you had a horse with heaves or COPD? And that's because those are the legacy terms we used for equine asthma. So in 2016, there was a consensus statement published by a group of veterinary experts who realized that the terms RAO, COPD, heaves were complex and confusing. We needed something that was that resonated more, that was more relatable for us, and that actually represented the disease more effectively. So since 2016, recurrent airway obstruction, or RAO, heaves, COPD, have been referred to as severe equine asthma. Okay? Now there's another type of equine asthma that's called mild to moderate equine asthma. And that is formally known as inflammatory airway disease, or IAD. Diagnosed much less frequently because many of those horses aren't as obvious. So often underdiagnosed. But if I turned to you and said, how many of you have a horse that coughs? Even occasionally when you get on, you go to trot off, the old man cough. Okay, if I can leave you with one thing this evening. Every cough means something. I know. Okay, lecture's over. We're all done. No, every cough means something. It is not normal for a horse to cough under any circumstances.
I heard it was just initially for them to
clear their lungs. Just get that crud out. Just give them a little.
For 11 years.
So I have a horse that you may have seen. Michelle was nice enough to put together the invitation for tonight, and she was very kind and put a picture of me with a horse on that invitation. And that was my old horse, Galaxy. And Galaxy had an old man cough. And Galaxy was a fantastic, fantastic horse that I had the distinct pleasure of competing internationally in the small tour for a number of years. He was an excellent citizen, and he would trot off. He was 17 years old when I was still showing him. I showed him till he was 20 in CDIs. And he would trot off coughing every time. And I would chuckle with my friends. Oh, old man cough, here we go. Well, if I knew then what I know now, I would know that Galaxy had mild to moderate equine asthma. So if your horse coughs infrequently, it's not necessarily asthma. But if your horse coughs infrequently, it is not normal, and it does warrant an evaluation to say, hey, why does my horse cough? Because you wouldn't want to leave a stone unturned, and you wouldn't want to leave a subclinical disease or a less clinical disease that may progress. And we don't know if mild to moderate asthma progresses to severe asthma in horses. The evidence on that is conflicting a little bit. There's more research to be done. But in many horses that have the occasional cough, it can be mild to moderate equine asthma. So what are other symptoms of mild to moderate equine asthma, if you're thinking about it? What do you think? It's relatively not that easy to diagnose because the symptoms are variable. Sometimes the symptoms are just poor performance. How many of you have ever ridden a horse that just didn't want a canter? Just doesn't want a canter.
I'm raising my hand for her.
Oh, you're raising your hand for your colleague that's here having a little rest.
Yes.
Perfect. Okay, so Ruby knows one right away. Everyone should have a friend like this that looks out for us when we're asleep, right? Answers all the questions. I love it.
She's also my sister.
Oh, she's also your sister. Okay, well.
Kind of.
Is she your sister and your friend?
Yeah.
Just say yes. Yes is a good answer to that. Just say yes. Mild to moderate asthma is characterized by a variety of subtle symptoms that can be the occasional cough, but different from severe equine asthma. So severe equine asthma, cough is much more common, so you tend to hear it much more frequently. The other thing in severe equine asthma is think about those horses with COPD and heaves that really struggle to breathe at rest. A horse with severe equine asthma struggles to breathe at rest. That is the distinguishing clinical feature. Right? It's
Without work.
Without work.
Okay.
Yep, a horse you see them. They stand in a stall, and you think about those heavy COPD horses, and you always want to move them to the stall by the door and give them a bigger window and give them fresh air, which are all the right things to do because they struggle to breathe at rest. They get what we call a heave line, right? So you may see that as they breathe, they have such abdominal pressure trying to breathe that all of their abdominal muscles, it's like they've been doing sit-ups for their entire life. They've got great obliques muscles that show. So that is the distinguishing feature between the two conditions, mild to moderate and severe. In mild to moderate asthma, the prevalence of mild to moderate asthma varies dramatically depending on the population of horses. So think about racehorses. How many of you have ever worked with racehorses or any experience with racehorses? Okay, so think about horses in a high-intense training racing stable. A lot of horses in a barn, right? Tends to be a sort of closed or controlled environment. They don't get a lot of turnout. They go to exercise and they go back to their stall often and whatever their routine is. 80% of horses in active training barns suffer from mild to moderate equine asthma. Most undiagnosed because they tend to get a slightly runny nose. They have a little bit of nasal discharge. It gets interpreted as something else. Allergies, right? There's a lot of things that we can call that. So that's the case for those horses. In performance horses, dressage horses and jumping horses, the incidence of mild to moderate asthma has been noted to be in some cases as high as 20%. And in some cases it's much lower. The incidence of severe equine asthma is 11 to 17%. So those are the horses that struggle to breathe at rest. Much more easy for us to visually and clinically interpret. But in all of those horses, and in any horse that coughs, a full veterinary exam is warranted because we want to know what the cause is. And you know what? Your horse might perform what you think is perfectly well, might meet all your needs, might appear healthy and happy, but every cough means something. And even as veterinarians, we don't think about that. I'll be perfectly honest with you. Veterinarians walk into a barn and they hear a horse cough, and nobody stops and says, "Who coughed?" If you're standing there and you're in a barn and you hear a horse that's coughing and they're coughing, but if you just walk by and one like randomly coughs the occasional cough, so if you're looking for this, a right thing to do.
Yeah, we look for it. If they're just standing there and
Yeah.
it's a quiet day and somebody's coughing, we go see who's coughing.
Perfect. And that's what you want to do, and you always want to inspect who that is, what are they doing. And the next time you get on and you trot off and your horse gives a little cough and the old man cough happens and they're clearing their lungs, remember that that's not normal. That you wouldn't pay attention to, right?
Yeah, because they do it when they go out. There's a lot of dust in the barn, a lot of particulate in the air. And
Yep.
I just figure we try to make sure all the hay's down and everything's down so they're not like, stuck up, down.
Yep.
And we just know there's a lot of particulate in the air.
Yep.
And so when they go out and not always.
Yeah.
They don't always do it.
They don't always do it, but they do sometimes.
Sometimes,
Yep.
yeah. So we just figure they're just cleaning out all the crap that they inhaled.
And fair enough. So that leads us to the next sort of topic for us to cover. So if you think about this, you've got a horse that may occasionally cough. Maybe not. You've got a horse that may not want to canter. Slightly poor performance. And you've got dust in a barn. So think about all the things in a barn that even in our best effort to control the dust, right? So how many of you keep horses on shavings? Anybody keep horses on straw? So, okay, and not commonly in Florida maybe as much, but maybe if we go up north or we go somewhere else, often on straw, right? You do mushroom?
No, I mean like people who have straw, they...
Oh, they get it taken away, the mushroom farm, right?
Yep.
That's recycling, that's good. How about hay nets? Do we feed from hay nets? Or hay bags? So the primary sources of dust in the barn are hay and bedding, mostly hay. So even good quality dry hay can have a lot of dust. Hay that we don't think is dusty. So everybody look at a piece of hair, one tiny, tiny piece of hair. Yeah, or look at your neighbor's hair if you can't see it. One tiny, tiny piece of hair. So if you look at one tiny, tiny piece of hair, the diameter of your hair is measured in microns, right? It's probably about 50 microns. 1/10 of the size of a piece of hair. 5 microns is what we call a respirable dust particle. Respirable. So it's inhalable. But big dust particles are inhalable, right? Flies are inhalable. I mean, this can happen, right? So we can inhale things that are much larger. But if you inhale something, it doesn't necessarily get to the deep part of the lung, right? It tends to either impact somewhere in an upper airway, get coughed back out. But in a horse, they have what we call a breathing zone. And the breathing zone is the area around their nose, because horses have to breathe through their nose, right? They cannot breathe through their mouth. So the breathing zone is around their nose. So if you think of where their nose is, well, their nose is in their hay. And their nose is in their shavings. And if their nose is in a hay net, now it's in the hay net and it's up and it's not down. And they're breathing in these dust particles. So you know how pretty it is when sun comes through the window of the barn and you see that ray of light coming in the window, right? That's dust. A ray of sunlight's not visible to the naked eye. It's the reflection of all of the dust particles there that allow us to see the sun. So the barn is full of what we call respirable dust particles. So respirable dust particles in hay and shavings are less than 5 microns. This is 10 microns. This is 50 microns, sorry. So you've got 1/10 of this. That's what our horses are breathing in. That's what's causing asthma. Because it's an irritant that causes inflammation in the lower airway. So it's not an allergy. Asthma in horses is not an allergic disease. It's caused by respirable dust particles. What's your question, Ruby?
By letting him out at night, could that help that with the dust or that?
Did you study before you came here? Just say yes. Because otherwise you're way too smart. So Ruby's question was, if we put them out at night, can that help? Well, of course that can help. So one of the biggest things that we can do for horses that are suffering from equine asthma is put them outside on pasture as much as possible. Because the breathing zone is cleared. And those respirable dust particles are far less, right? So respirable dust particles, not inhalable particles, are what cause equine asthma. It's caused by inflammation. And the clinical sign is a cough. Okay, the old man cough is not normal. When we trot off and they give the old man cough, it's not normal. Big learning for some of us, I know. So equine asthma caused by respirable particles. So we talk about hay. So hay is the most common source of these respirable particles, even good quality hay. But if you feed any type of hay that's a little bit dusty or a little bit moldy, and we try not to do that, right? Obviously, if we see a bale of hay and it's moldy, we try not to feed it. But sometimes there's a little bit of mold in the hay that we don't see because it got baled up when it was a little bit wet, or there's an increased amount of dust in the hay, and that can change dramatically the impact for susceptible horses. Feeding horses from a hay net increases the respirable particles by 4 times.
Even if you hang your hay net low, I mean, not enough to get their foot in, but we try to hang the hay nets as low as we can so they're not lifting their head to.
Yep. So, I mean, I can't give you the exact height that this has been looked at, but over an abundance of cases. So the challenge we face is on the flip side, if you have a horse with gastric ulcers, it's beneficial for him to eat from a hay net. So if you have a horse with ulcers and asthma, I don't know what to tell you. But hay nets will increase respirable particles by 4 times. Okay, Ruby.
Do you recommend to feed them hay on the ground that horse shows, or so then they don't get a stomach ache, to just feed them in a hay net?
I'm going to recommend to you that if your horse is at higher risk for asthma, that you feed him on the ground. And if your horse is at higher risk for ulcers, you probably should feed him from a hay net, because not every horse is susceptible to asthma. It's certain horses. So you can put every horse in the same environment, in the same barn, with the same feed, in the same stalls, with the same shavings, the same amount of dust, and only one coughs. Or only one doesn't want to canter. Or only one has subclinical disease. Or only one is standing with COPD and a heave line. They're not all the same.
So do you recommend watering the hay?
So we can water the hay. So we can water the hay or we can steam the hay. And I will tell you that there's a number of studies that show minimal to no benefit unless the hay is so well soaked. So not just wetting it with a hose, soaking it all the way through until it's really soaked. So you can do that. That will help to decrease the dust in your hay, absolutely. But the best thing to do if you have a horse that suffers from asthma is to feed it pellets or cubes. Hay pellets or cubes. Hay pellets or hay cubes? So if you feed hay pellets or hay cubes, in many cases, the environmental management of doing that alone will alleviate the clinical signs for your horse over a period of time. And that period of time can range from 2 weeks to 6 months. But often you can have a horse that is in one environment, highly susceptible, struggles to breathe, has poor, decreased exercise tolerance or poor performance, difficulty recovering from exercise. You take it out of the existing environment, put it in a new environment, and the horse does extremely well. It can recover completely without medication if you can manage the environment enough. So equine asthma is an environmentally induced man-made disease in horses. Horses are amazing, wonderful, gracious animals. We all have very special places in our hearts for them, right? And we give them almost every disease that they have because most things that they suffer from are man-made or induced by the jobs that we're asking them to do. And so we have a responsibility back to them to help minimize these risks. And environmental management is the biggest thing for any of us when it comes to managing equine asthma.
So do sand arenas help the horse, or does it make it worse, or is grass arena?
Sand arena or grass arena? I really believe you studied. So,
No, I haven't.
Okay, you just ask really good questions. Okay, so sand arenas. So how many of you have ridden around an arena and little dust clouds followed you? Okay, dust from an arena, dust from a dirt road, next to your riding arena or next to your barn. All of these things can contribute to a highly susceptible horse's illness. So the dust doesn't have to be immediate, but if it gets into the breathing zone, and dust can carry these tiny, tiny particles, can carry and create those rays of sunlight coming in the window, anything that can do that, a respirable particle. So if you're riding your horse in an arena and that little cloud of dust is following you, or there's a dirt road and a big dust cloud goes by and you have a highly susceptible horse, and he's breathing that in, that's an irritant. That will be a cause for equine asthma, for susceptible populations. Now, the saving grace to that is, does anybody here jump? Okay, Jessica jumps a little bit. We have a little bit. Some of the girls jump a little bit. Jumpers hold their breath over a jump. So if you can time perfectly that they jump when the car goes by on the dirt road, you've resolved your problem. Okay, so horses don't breathe over the jump. They hold their breath over the jump.
I have one more question.
Okay.
So we put some of our ponies on dust pasture,
Yep.
like no grass, because we're worried about them getting Cushing's or laminitis. So would that make it worse, or would a grass pasture be better?
So can you see where this story's leading? Because now we've got compiled issues, because we've got ponies that have potential to get Cushing's or PPID, laminitis, so they're not on grass. Maybe they have asthma, so they are on a dirt paddock, but we're not sure that that's the right place to put them. And they eat from a hay net because they're susceptible to ulcers, and now we really don't know what to do. Glass bubble for the pony. So, but you're absolutely right, Ruby. So if you put your horses in dirt pastures or dirt paddocks, and they're dusty,
We'd like to hire her.
I know. I've already got dibs on Ruby. She's coming with me. She's coming with me. I have a feeling she's going to charge us a lot, though. I don't think this is going to be an easy negotiation. Okay, but great question. So absolutely, if your horse is in a dirt paddock, or we're in Florida and we put sand piles in the middle of a paddock where the grass gets eaten, anything that causes dust and respirable particles will make a susceptible horse much more vulnerable. So when we talk about treating equine asthma, whether it's mild to moderate or severe, the number one thing to do is manage the environment. I can talk to you all day long about medication, all day long. And it works, no question that it works. But if we don't get the environment managed, what happens as soon as you discontinue the medication? The horse gets sick again. The symptoms will flare. And they'll be exacerbated by the environment. So when we talk about treating equine asthma, what we like to say is it's as easy as 1, 2, 3, because there's 3 steps. The first is environmental modification. It is the most important. It is the crux of everything. It will be your friend, it will be your foe. So you've got to manage the hay. The biggest thing you can do to a horse that's severely affected is get them onto a pelleted hay or a hay cube, because that is where the bulk of the breathing zone is impacted, is when their nose is in the hay. And Ruby, I'm going to ask you to do something.
Okay.
It's homework. You going to be okay with that?
Yep.
Okay, good. So you're going to sit in your pony's Mr. Pickles' stall.
Okay.
And when Mr. Pickles is eating hay from the ground, you're going to see his nose in there, and you're going to look for that ray of sunlight, and you're going to watch how much dust comes out of your really nice, good, beautiful green hay.
Okay.
Okay? And then you're going to call me and let me know how that went. Perfect. Deal.
So we have a horse that goes...
Don't tell me you don't have that.
No. We have a horse that goes on soaked hay, and if I compared them, would I see more dust coming off of the one with non-soaked that wasn't soaked, and not as much dust coming off of the soaked hay?
Okay. Now we have a science experiment.
Yeah.
Yes? Now we have a science experiment and a potential for a publication. So, so Ruby's going to evaluate the soaked hay versus the dry hay in the same environment and visually see, and you will visually see a difference, because you do reduce the dust substantially by soaking, as long as you soak the hay all the way through. The big mistake we made, and I've been a victim of this as well, right? You stand with a hose and you put it in a skip bucket, or you put it in a wheelbarrow and you run the hose over it for 10 minutes or 15 minutes, and then you take it out and you feed it.
We leave ours in a bucket full of water to the top for an hour, so then all the...
Of course you do.
Well, it's a laminated course.
It's a laminated course, so we're also washing the sugar out of the hay, right?
Yeah.
Okay, so this, we've got multi-purpose now.
Yep.
She's coming with me on a road show. Yeah.
Okay, so they make these boxes that are like hay nets, but instead they go on the ground.
Yes.
Would that help, like with the dust and like an ulcer?
Yep, it could. So you may have the perfect compromise there, right? If you can put it into a box where the dust sort of stays contained, the horse can pick at it, because the purpose with ulcers is we want them eating constantly. So we want them to have a job eating their hay. And you could wet that or dampen it and put it in something like that, and that would be a good option. Yep. Did I see another question somewhere? A question here.
Do horses become more susceptible with age?
Okay, do horses become more susceptible with age? So horses that have mild to moderate asthma tend to be younger, and horses with severe asthma tend to be over the age of 7. So a lot of times that old man cough, that's why we don't see it until they tend to be an old man, and that's why we brand it that way, right? We sort of trot off, and the horses, we've had them for a while, and somebody said for 11 years that they had a horse that trotted off and coughed every day and never progressed, because it's not necessarily a continuum. So horses that have mild to moderate asthma don't necessarily become severely asthmatic. That is a non-predictable equation. So we can't say that.
You know, I had people in my barn that use those steamers.
Yep.
But I was like, how much nutrition is left in there if you steam the heck out of it?
And so I think that's again the fine line balance, right? Is you have to really know what the quality of your hay is when you put it in there, and the quality of your hay is when you take it out. And so when you really want to know what the nutritional value is for anybody, I would have your hay tested. So just call one of your feed representatives. Most of them can do it for you, or the feed store that you get the hay from. Have them use a hay probe, send your hay away, and do the analysis.
Actually, there were people who were leasing.
Yep.
And they always used a hay
steamer
every night.
Yeah.
And of course, sometimes like the people who are staying at my barn, I'll take care of night check for them.
Yeah.
And then they have these big soggy tubs of hay to dump.
Yeah. But the hay steamer smells really good.
It just smells. It doesn't.
Thanks. Like it does, right? Who has a hay steamer in their barn? Anybody have a hay steamer in your barn? Do you use it a lot? Do you have Ash? You have a hay steamer? Yep. So I think the hay steamer has a great role to play, right? It can certainly reduce the amount of dust. And as far as the nutritional value goes, you know, you need to work with your nutritionists and find out from them, because there's actually mixed data on the impact of steaming and what. And
I was going to say, I've read a lot of publications on that.
Yeah.
Her mother.
Oh. Do you want a job too? Because apparently, yeah.
I do need a job. I have to pay.
We live in Texas, though.
Oh, well, we're mobile. It's all right.
Okay.
But steaming retains more nutrients than soaking.
Yes.
Because when you soak, you are soaking out the sugar.
Yeah.
And starches to less than 10%. So if you do choose to soak, you got to remember you're taking away a lot of calories.
Okay.
Steaming, you actually maintain more calories.
Yep.
As long as you do it, you can't leave it alone.
Yeah, you have to be very good at steaming.
Right.
Yes.
You've got to be diligent. You need
Yes.
a bunch of those.
I know. We need, like, this is like a full-time job for someone like Ruby.
No, she steamed it for a certain period of time, and then she would put it in these big muck buckets.
Yeah.
You can't do that because it's mold.
Yeah.
Mold. You cannot do that. You have to steam it and feed it.
And feed
Well,
it.
I fed it at night. She would just steam it for me, and then she'd put it in the bucket. When I came late at night, I would feed it to everybody. I mean, it wasn't
You have to
sitting there all
be
day.
very careful in
Yeah.
Florida, because if you steam it and leave it in a
I mean, I'm talking about maybe, it was there maybe a couple hours.
Yeah, a couple hours is probably.
In a muck bucket, you know, she'd put it in the
I
bucket
think
right
the-
to at night and drop it off.
I think the big thing about steaming and wetting hay is we're all intending to do the right thing, right? So we're all trying to minimize the dust. And so there's variables in what the results are. And the best thing to do is work with your nutritionists, but make sure you get your hay analyzed to know, because it's impossible to say what nutrients are coming out if you don't know what nutrients are coming out, if you don't know what nutrients you're putting in. Chris has a question.
Has there been any studies on feeding haylage?
Yes.
Haylage.
Yes, haylage. So anybody here feed haylage? Yeah. So haylage is not very common in the US. It's quite common in Europe. And haylage does reduce dust dramatically and retains nutritional value. It's actually quite high in sugars and nutrition. So haylage is a great option for asthmatic horses, but we don't have haylage a lot here in North America.
What is it?
It's baled hay. Chris can explain more.
It's
haylage.
that they, typically speaking, when you bale hay, normal hay, they bale it, I think, at 30% moisture, I think. And haylage or baleage, depending on which country you're living in, they normally bale it around 60%, so they bale it and then they straight away wrap it in plastic, and then it ferments over, I don't know.
It's like these big, huge
Round. It's like big round bales.
Generally speaking, cattle farmers use it for cows, but with cows they use also corn and alfalfa and everything else.
Yeah.
But for most sport horses in Europe and England, Holland, Germany,
They feed haylage.
they use it just normal ryegrass or pasture grass, and they let it ferment over the winter time. But the nutritional value is much higher, and there is very, very little dust.
Dust, yeah. It's an excellent option.
Get from the big brown thing into your horse's stall and not get scratchy.
So Ashley's asking a great question too that's about round bales. How many of you have horses that you feed on round bales in pasture? Okay. How many times have you gone out and seen a horse with their head in the round bale, buried into the round bale, right? Okay, this is probably the most detrimental case for a horse susceptible to asthma. For a horse not susceptible to asthma, it's great. For a horse that is susceptible to asthma and they stick their head in a round bale, what happens to the breathing zone? It's like claustrophobic, right? It's like a buffet for the horse. They're delighted, but they're not breathing. Richard.
Is there a test that you can check and see if they are susceptible?
So unfortunately, there's no way to test if our horse is susceptible to asthma or not. Now, there's certain predispositions. So there's a very subtle genetic predisposition in some familial lines within breeds. So it's not a breed predisposition, it's a genetic familial line within certain families. And there's some subtle data that associates viruses, so certain viruses, if your horse has had a virus, that may make them more susceptible. But none of that is very well documented, and still lots of room for research, and no test that we can say, hey, this is a susceptible horse, let's house them completely differently. So the big things for us are the clinical signs. So the clinical signs we've talked about, to recap, Ruby can help us. If I have a horse with mild to moderate asthma, First of all, we just talked about it. What's the age of that horse generally? Mild to moderate? Under 7, right? Tend to be younger horses. Clinical signs. The occasional cough. Every cough means something.
Slight runny nose or discharge.
Maybe have a little nasal discharge. Per performance. Doesn't want a canner.
Her pony bucks for the canner, but I think that's just him being naughty.
Yeah, I didn't read anything in any of the literature about bucking ponies and asthma.
Yeah, he goes up and then whoa.
Oh yeah, okay. That's a different thing. We got to talk about that after.
Okay.
Totally separate. Yeah, totally separate. That's a typical pony. Yeah, that's a pony disease.
Okay.
So that's it. For severe equine asthma, clinical signs?
Not breathing at rest.
Okay, everybody's saying it, so I feel my work here is done. Difficulty breathing at rest. That is the cardinal symptom for a horse with severe equine asthma. So treating asthma, we've talked about the environment. I told you it's as easy as 1, 2, 3. The second thing is corticosteroid therapy. So when we
have to be steroids.
Okay. So asthma is an inflammatory disease, and the very first thing we need to do is get rid of the inflammation. So corticosteroids are the drug of choice for treating equine asthma. Now, none of us want to use corticosteroids long term, and there's ways to use steroids that they have less risk of side effect than others.
What if you have an EPM horse that now is
See,
getting...
we have all these complex scenarios, right? So we have an EPM horse, or we have a Cushing's horse, or we have something else, and we don't necessarily want to give them steroids, right? Because your potential pony that maybe has Cushing's disease and could be laminitic, we definitely don't want to give it steroids.
Yeah, we have a horse that I think he has ulcers.
And he has ulcers. Well, I mean, you know. I need you as you know what I need you for? I need you as a full-time customer. I got a whole pipeline of stuff here for Rudy. I need Rudy as a full-time customer. Ruby, sorry. So the thing is, when we're using steroids, inhaled corticosteroids will have less systemic effect than oral or injectable.
Oh, is that like Q-bar?
100% of the time. Is that like?
Q-bar.
Yes. So if you give something in an inhaler, it will go to the lungs, and it has less potential to be systemically absorbed. Now, the challenge we have with horses is twofold. We have a huge lung mass. So if you took the airway of a horse and you laid it out and unfolded it over and over, it would take up 10 tennis courts.
Whoa!
Or a whole football field.
Yeah, I don't know. Can you look up for me? Can you talk to Siri and ask her football field versus tennis court? I don't know. 10 tennis courts. So it's a lot of lung mass. It's deep into their lung. And we said earlier, when I treat a person for asthma, and for those of you that have asthma, let's do this. But for those of you that have asthma, when you take an inhaler, what do?
Inhale. Deep breath.
Right? Big, deep breath. And if you have what we traditionally call a puffer, which is a pressurized meter dose inhaler, MDI, or if you have a dry powder inhaler where you click it and it cracks and you breathe that in, it's always a forced inhale. Your doctor will always tell you, breathe deeply when you breathe it in. You can't ask a horse to, like we said, you can ask them, they're not going to do it. So a horse is not going to do that for you. So when a horse breathes in a steroid and we give it to them, we often give it to them in a spacer or a nebulizer, right? And the challenge with that is that if you look at an MDI and you puff a puffer and you see how fast that comes out, even in a spacer, a lot of that gets stuck on the inside of the spacer, and that gets into their lungs tends to lodge in the back of their oropharynx because of the speed that it comes out of the inhaler. And so in those horses, what ends up happening is a very small percentage of the drug actually gets to the lung. A larger percentage rests in the oropharynx or the upper airway and gets absorbed systemically. So now we're back to the situation of, well, should I just give him a pill or should I use a spacer? Now it's a better option always to use an inhaled product when you're treating a horse for asthma. The corticosteroid is always a better option if you can do it with an inhaler. A nebulizer, so how many of you use a FlexiNeb nebulizer? Okay, so a FlexiNeb nebulizer nebulizes the air, so it has less risk of that sudden high velocity impact. Some of it will still be a residue. They'll breathe more in, they'll get more into their lung, they still get some in their oropharynx, but it will help with the percentage. But even in nebulized drug, only 10 to 20% of the dose you're giving is actually getting to the lung. Now, it works, right? Let's not deny that it works. If it didn't work, we wouldn't do it. But it's a small percentage of what we're giving that's actually getting to the lung. So when we talk about corticosteroids, we don't want to give it to them, but we have to get rid of the inflammation. So the first thing to do is to get rid of the inflammation, use a corticosteroid. Try to use an inhaled corticosteroid versus an oral or injectable corticosteroid. Use it per the guidance of your veterinarian, but in many cases, they can limit that down to maybe 21 or 28 days, depending on the length of time. But in parallel, environmental modification. Question?
Yeah, so in humans, they looked at leukotrienes for causing asthma. And so like leukotrienes.
Leukotrienes, yeah.
Is
yeah.
a leukotriene inhibitor.
Yeah.
Have they looked at that in horses?
So different disease in horses.
Yeah, so not even.
Yeah.
Eosinophils are not a pathway.
Nope. Chris?
Is there a difference in withdrawal times versus like injectable steroids versus inhaled steroids?
So we live in a competitive world, right? So drug detection times are really important for us. And so yes, there's not great detection times published on inhaled corticosteroids at this point. There's detection times that are generally published on oral and injectable, and then we extrapolate from those. So we make an assumption, and then we say, okay, if there's a systemic level, then we'll add this many days. So there's a detection time, which is the time with which we can detect. You'll be fine. For you, go ahead. It's my husband. For you, go ahead.
Yeah. So when you can't do steroids, I think I was given, is it silver nitrate? Is that right?
Yep.
Silver. And
yep.
What does that do?
So yeah. Well, I didn't want to say it that way, but somebody said nothing. Yeah. So silver nitrate is going to attack a slightly different pathway in an attempt to help reduce the airway obstruction that you may experience. It is not going to directly target the inflammation as an anti-inflammatory, but there are people that use this, especially in a nebulizer, with some literature reporting that it's got some effect. And listen, when we work in a competitive environment, we're looking for detection times. We need to make sure that what we're using, we're able to use. We need to make sure that we enable our horses to the best of their ability, that we're not using something that's performance enhancing in any way, shape, or form. And so we try whatever we are recommended to try in those moments, and responses to therapies will vary. So some horses will respond well clinically to something like that, and some horses may not. You may treat exactly the same horse.
They say saline. What does saline do?
Just moisturizes the airway and tries to get the dust particles out of the airway. So the big thing with that is that you're getting dust particles out, but we said it's 1/10 of the size of your hair that they're inhaling, and the biggest impact there is going to be actually on the upper airway, because you can't get that deep enough into the lung.
Has there been any research or studies shown about how you should train horses that have asthma? Like, should you do shorter intervals or longer with maybe less stress, or?
So specifically training them with training horses with asthma and the results that you get, pulmonary function is compromised in horses with mild to moderate equine asthma. So in race horses, they have looked at pulmonary function in actively training horses and the impact on speed times. And so these horses may not be clinical. They're often subclinical, but they may have a slightly runny nose. but somebody's training them and they think the runny nose is due to an infection. Often they've got them on antibiotics because they think there's some systemic thing going through the stable. In many of those cases, it's mild to moderate asthma and speed times will be decreased. So anything that decreases lung function. So when asthma decreases lung function, that means that your horse cannot get as much air. So they can get to hypoxia much faster, so their muscles don't get oxygen as well. And so you can impact that in mild to moderate cases. I'm going to take one question and I'm going to come back to you, okay?
Okay.
Okay.
So what about those trainers that are using Lasix, you know, so that when these guys start bleeding in their lungs and the horse also has asthma?
Yeah. So that's in the racing industry, and there's, so EIPH, which is bleeders in racehorses, they treat them with Lasix. Then they think they have asthma. They don't treat the two things the same way, and we do completely different research in EIPH than in asthma because we don't see a cross-relation between the two conditions. But very common in racing to be treated with Lasix for bleeding, and then they have 80% of them that do have asthma, but we haven't seen the link between the two things.
Have there been any studies? I have a horse, I got him at 7. He had slight asthma too, that's diagnosed that he's 18 now. He's not any worse. When you go to trot, he coughs twice, and then he blows his nose, and then you can ride him for an hour. No problem. He doesn't cough in the stall because I believe in turnout he's out all the time, a lot. But he did develop anhydrosis at 10. He's had it every hot summer in Texas since I've had him. And I wonder if there are any studies done if that's related from the slight asthma to the anhydrosis non-sweating part. It's really hard.
I can't tell you that I know of anything that's been done to show a link. I can tell you that the horse that has that occasional cough and then coughs the junk out and keeps going, that is something to do. I mean, you think about why does that happen, right? Something's in their airway that's causing irritation. If it's in your airway and it's causing irritation, the response to irritation is inflammation, and by definition, equine asthma is inflammation of the lower airway.
Can you see it on a scope? If you scope them?
No, you cannot see it on a scope in most cases. So you can do lung biopsy, which is a more invasive thing. Pulmonary function testing is the gold standard diagnostic. So, but pulmonary function testing is only available in large respiratory centers at universities, or pulmonary function testing, where they literally can test the resistance within the lung, the airway resistance as they inhale and expire air.
Is that where they put a nebulizer on and they've got them on the...
Yeah, it looks like a nebulizer, and they put them on, they hook them all up. But there's very few centers, respiratory centers, that do that work. The diagnostic tool that we use most commonly in the field is called a bronchoalveolar lavage. It's different than a tracheal wash. So a BAL, which is a lot easier to say than bronchoalveolar lavage, you put 250 mils of saline into the lung, and you suck it back out, and that will give you. It's not a coughing competition to see how far they cough after that. It is you pull the fluid back out and you look at the cell types. And there's some distinguishing features of equine asthma that they can look on a BAL, but it needs to be supported by a full history and clinical exam that goes with it, because the most distinguishing feature in a BAL of a horse with asthma is greater than 25% neutrophils. Neutrophils are cells associated with infection. So what happens is a lot of veterinarians do a BAL, they see greater than 25% neutrophils, and they may interpret that as an infection and start to treat your horse with antibiotics. Because the nuances of a BAL need to be interpreted in light of everything else. And that's for severe equine asthma. So you should be seeing some sort of respiratory distress.
How do you get water in their lungs?
Just push it in there really fast. It's 250 mils, and you put it in with a scope, and you just put it in and pull it back out. Yeah.
You get it all out.
But the big thing about that is 250 mils is a lot. It's a lot more than has been traditionally used. So that's a recommendation that's under evaluation right now with the experts as they try to come to consensus on that. But what we know is that in some cases we've historically used things like 50 mils. That's not enough.
What's 250, about a quart, or how much is it?
It's a quarter of a liter, so how much is, I don't know.
Oh, no, it's like a little over a cup.
Yeah, 250 mils. quarter of a liter.
Gallons.
No, it's not a big gallon. 4 liters in a gallon, so it's 1/8 of a gallon.
50 mils. So 5 of your perfumes.
It's 5 perfumes.
5 times size your
It's, you can take 3 fluid ounces, which I think is, that's by weight, so I don't know how many mils that is on a plane.
I think you're about 50 mils or 100 mils. You're about 100 mils on a plane, I think.
Oh, and that's
So
3
2.5
ounces.
travel size.
So there you go.
Travel size, 2.5 travel sizes.
Okay.
It's not that much.
You can use normal people saline spray in a horse's nostrils.
You can do that to help moisturize. So what you're trying to do in that case is suppress the dust, right? We're all talking about the dust. So we've talked about step 1 in treatment, which is environmental management. Step 2, corticosteroids. Step 3, because I told you it's as easy as 1, 2, 3. Step 3 is to use a bronchodilator. So for those of you that have asthma or have horses with asthma, how many of you have used bronchodilators?
That's like Ventapulmin.
You've like Ventapulmin. So clenbuterol. And people, albuterol. Bronchodilators do exactly that. So they help provide relief to bronchospasm, but they don't do anything with the inflammation. So the inflammation, you need the steroid, and then you use a bronchodilator for immediate relief if you need to sort of expand that airway. But that's a short-term, intermittent relief. The anti-inflammatory is the critical component. Coming back to Ruby.
What about the racehorses that are in the very back? You know, when they finish, they're covered in dust and mud.
Yep.
So what about those racehorses?
You know what? He's got to run faster. He got to get up front. That is high-risk environment. And can you imagine the stress that guy has when he goes back to the barn and he came at the back of the pack? Now he's got ulcers and he's got asthma and he's got all kinds of... He's got a lot of stuff going on, the guy at the back of the pack.
The trainer puts me in claims race.
Exactly, the claims race. Yeah, he's probably got sore legs. He's been running as fast as he can go. But really good point, Ruby. So anything like that that kicks up dirt or dust, all of those scenarios. But the bronchodilator is third. So when I tell you treating equine asthma is as easy as 1, 2, 3. Environmental modification plus corticosteroid therapy plus or minus bronchodilator administration. And the environmental modification must be continued throughout. Because as soon as you stop, a susceptible horse is always susceptible. They will just revert back unless the environment in which they are kept is changed in a way that minimizes their risk of inhaling the respirable particles that they are susceptible to. Question?
So are racehorses more susceptible because of environment or because of there's just so many more racehorses?
So it's probably a combination of both things, but the environment is really a key thing for them. They're kept in high-intensity stables where there's a lot of horses. They tend to be in closed barns. They're not always in big open barns and airways. They spend a lot of time in a stall, and sometimes the stalls don't have the best ventilation or the best airway. They're fed hay. There's a lot of dust, and they're being asked to do a lot of aerobic work. Question?
Do you also recommend like watering down your bedding, like even if it's like the shavings and not just like the...
Yeah. So how many of you pour in those bags of shavings and bank up the stalls because nothing looks nicer, right, than a big banked fluffy stall? I think that looks lovely, and it does until the horse has asthma. And then in those cases, what you want to do is minimize the amount of bedding, get them on rubber mats as much as you can with the smallest amount of bedding, and go for even cardboard has been shown to have less dust particles, so cardboard chip. Hemp probably has less. I don't have data on
I
it.
lived in Kuwait, and the shredded newspaper was the best.
Anything that minimizes dust. So yeah, so if you, whatever it is that you have that has the lowest amount of dust, but straw is the highest concentration of dust. Then you're going to get to shavings. Then you're going to find what type of shavings are low dust. Then you can go pellets, you can go to cardboard bedding, you can go to straight rubber mats with just a little bit of bedding, so things like soft stall or things that are pure rubber bedding if you've got horses that are severely affected. And the most important thing for those horses is get them outside as much as possible so that the breathing zone is free. So those are the big things about asthma and treatment.
One quick question. So how much difference between hanging the hay bag or putting it on the floor?
4 times respirable particles. So you have 4 times as more.
Well, we do hang our bags low because we like the guys to have their heads hanging down. And they don't, seem to get their feet stuck, right? They don't seem to get their feet stuck. But it's still 4 times?
4 times. So I don't have the details on, I'd have to look at how high they hung the hay bags in any of the data that's been generated. But it's when they poke their nose into it, right? So it's the pushing of the nose.
They gotta poke it in and pull it out.
Which may or may not create more dust, right? Because as they pull it out, you may get more or not. Ruby's out for hire if you'd like her to come monitor the dust.
I know. So you're saying putting it on the floor is actually better.
Yeah.
Can I have one other question really quick? And I know it's off the different side, but why is it worse for ulcers to hang a hay, better for ulcers to hang a hay bag?
Because horses with ulcers, so completely separate topic. That's okay, but horses produce gastric acid 24/7, so they don't only produce it when they eat. And you want to keep something in their stomach, and what tends to happen with a hay net or a hay bag is that it'll give them something to pick at, and they'll adopt more of their instinctive grazing behavior out of a hay net or hay bag.
Why we hang hay bags?
So that they eat slower.
So they eat slower.
Yep, which is perfect for ulcers. So if they eat it quickly on the ground, then their stomach sits, it's gone and the stomach sits empty. Yeah, so you want to put a hay bag for them for ulcers, because in ulcers, our goal is to have constant intake for as many hours in the 24-hour period as we can. So treatment, 1, 2, 3. Yep, environment, steroids, bronchodilators.
Does the climate, as far as seasons or where you live or anything like that, have an effect on?
Absolutely. Yeah, so absolutely. So anything that increases air density, there's certain pollens that horses can react to because they're inhalable again. So it's not an allergic reaction, which is the eosinophil question that was asked earlier. So eosinophils are a response generally to an allergic reaction more than an inflammatory response or pure inflammatory response. So, so anything can be like that. Endotoxins, ammonia. So in stalls, anything like that that irritates and causes inflammation in susceptible horses will lead to a cascade that can present as asthma.
I was thinking more about cold climates and the seasons and all that. Does that
so
I know it affects people with their asthma.
Absolutely. So and I think what happens, and for any of you that have asthma, is I have asthma, and my asthma is better in a warm climate than a cold climate, but I have friends who have asthma whose asthma is better in a cold climate than a warm climate. And I think it really depends on what your susceptibilities are. And so that's where you get some of that seasonality to that. Richard?
Yeah, I was just saying that some people have a little hesitant to feed pellets, forage instead, but now they've come up with these eye feeders that they can then drop every so often, so that again the horse has a chance to eat more frequently.
Yeah, more frequently.
Is that, again, I would think, makes sense for a horse that is susceptible to this, right?
Yes, absolutely. So anything like that. The data has been looked at in pellets, and you significantly decrease the exposure to dust by feeding hay pellets. So if you talk to any of the experts in equine asthma or respiratory disease, if you have a horse that's affected by severe equine asthma, it's the first thing they'll tell you is you put that horse on hay pellets and get him under control with the steroids, and then you can wean him off the steroids. But if you keep him on hay pellets and you manage the environment and you put him on a low dust bedding, they have really good results at maintaining those horses symptom free.
What about almost every stable here has, of course, is fly spray systems in each stall.
Yeah.
And of course, none of us want flies or mosquitoes because that causes other problems. But is that a respiratory concern?
So I think anything that gets inhaled that could be perceived as an irritant could potentially cause inflammation. Do we have data specifically on fly spray systems and overhead systems? No. Not that I know of. I shouldn't say no, not that I know of. I'd have to look into that further. But the big core message is anything that's an irritant that has that respirable particle size. If the particle size is bigger It's going to lodge in the upper airway, and a lot of that may just lodge in the upper airway because of how they breathe it in. If that's the case, it's not going to cause asthma. For it to cause asthma, it has to get to the lower airway. For it to get to the lower airway, it has to be less than 5 microns. If it's small enough that it's less than half a micron, 0.5 microns, so tiny, 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 those just get blown back out. So particles that are too small, it's a little bit like Goldilocks. One particle's too big, not quite right. One particle's too small, gonna get blown out. Something less than 5 microns and bigger than 0.5 microns is just right for equine asthma. So environment, corticosteroids, bronchodilators, we can't step away from the environmental message ever. It's really, really, that's the biggest challenge for us. Because when we say that we need to change how we do something every day, it's tough, right? It's tough for us to change a behavior, to change a management system, to change how we care for a horse, either because it's in a big racing barn where we've got a lot of horses, and how do you manage those differently? Or how do you manage one horse in a barn of 20 with everything else that we're trying to do? But if we go back to what we said at the very beginning of tonight when we talked about why we're all here, what brings us here, right? It's the spot they earn in our heart. So you owe them that back. We all owe them that back. That in every case, we do our very, very best to manage the environment, pay attention to the signs, and remember that every cough means something.
Does your company sell something there that's one of those?
No, this is a straw. Would you like another straw?
Oh, no, I thought it was something for a steroid.
We actually, full disclosure, we actually do make Ventipulmin. So we actually, Ventipulmin, which is clenbuterol, bronchodilator.
I mean, is that something you can use long term?
Yep, bronchodilator.
Like, okay, so I hear now that the message is that the getting rid of the inflammation is the most important part. So like if we're not treating that part anymore, we're still doing the bronchodilator, we're really not solving our problem.
You're really not solving your problem.
1, 2, and
1, 2, 3.
Because we're kind of doing 3, but not 1 or 2.
So historically, we used to use bronchodilators much more aggressively, and we use them for longer periods of time. But as we learn more about disease, and we learn more about susceptible horses, and we learn more about the fact that this is asthma, not necessarily heaves and COPD, and all of the other things we used to call it, then the bronchodilator is going to really fit into that plus or minus quick relief, and then they should be off it. So there shouldn't be a need in asthma for them to be on that long term.
So here's a people's Ventolin.
Exactly.
So what does it look like for a horse, and can you do it yourself, or does the vet have to do the treatment?
To use an MDI like this, how many of you used, can I just show the group this?
I've had it for a month, and that's rare for me. I don't know. Yeah. So it must be the similar.
Okay, so I have one that looks very much like this, yeah. So that is called a pressurized meter dose inhaler. It generates the aerosol inhalant by a propellant. It actually, there's actually really interesting data on those right now about the carbon footprint of propellants in inhalers, and they're trying to move people off of MDI inhalers because of the carbon footprint.
And someone mentioned a spacer to me that a doctor, what is a spacer?
So
as you talked about it in the horses treatment too, and I don't know.
So spacer is like a pediatric spacer. So if you had it's derived from human health. So if you have an infant and they have respiratory disease and you need to give them an inhaler, you can't ask an infant to take an inhaler that way. So they have what they call a spacer. And it's basically a plastic tube. I don't have one here to show you, but it's a plastic tube. It's about this long. It's about this big around. You take your inhaler and you put it in this end, and you have a little mask on the other end that in an infant you would put over their nose and their mouth. And then as you pump the inhaler, the aerosol is generated within the spacer, and the infant can breathe because you can't ask them to take in a deep breath. So they just breathe at their normal respiratory rate and take in the aerosol. So they extrapolated from that and modified it to fit the nose of a horse. So there's a number of spacers that are available that are made for horses. So it's the same plastic spacer, but has a different mask on the end. And you put it, some you put over one nostril, some you put over 2 nostrils. There's a spacer that can go on a FlexiNeb mask. There's an old mask that used to be called Aero mask. They don't make it anymore. But all of these things, you put an MDI inhaler like that, and then you're going to give your horse. Here's the super interesting thing in horses. None of those drugs are approved for use in horses by the FDA. They're all approved for use in people, and then we extrapolate. There's no defined dosage. So it's whatever somebody has found that worked. So there's some research that said, oh, if you use it at this many puffs, it seems to work. But there's no described dosage on MDIs in horses. So have they been effective? Absolutely. Have horses responded to them? Absolutely. Is there room for us to do better? Absolutely. Absolutely.
What about coronavirus in horses?
Oh.
I'm not even sure about dogs. I think dogs can get it in the mouth.
Yeah, and you can vaccinate.
But dogs don't get it, I think. But no one talked about horses yet. I don't think so.
Yeah, so coronavirus is a family of viruses, so all species are susceptible to coronavirus. Do we have reported cases of coronavirus in horses right now? No. I just read something about a dog in Hong Kong that tested positive for a coronavirus, and they were trying to understand if it was, they think it's corona. So there's also different, so this is coronavirus 19, right, that we're dealing with, COVID-19.
So there's many variants.
Yes.
It's called corona because the virus particle itself is really cool looking.
Yes, it's very cool.
But it is. It's got like little rays of sunshine.
It is.
But
you'll see all the, if you see it in the CGIs that they're using a lot in the news now, you see like all the little receptors.
But anyway, there's so many variants. It's like influenza, except that
they
it's
evolve.
more respiratory.
Yeah. And they mutate quickly, and we hope they mutate quickly. So I couldn't speak to it directly with COVID-19.
We'll see it in the future.
Yeah. Yeah, if the apocalyptic coronavirus doesn't get us. But it is something to take seriously. It's not something to take lightly. It's something that we need to pay attention to, right? We have a responsibility. And a social responsibility to the people around us as well. I want to say thank you all for your time and your attention. I enjoyed your questions and your participation. I hope that you found it valuable and meaningful, and that if there's just one or two little pearls that you remember that help you manage a horse that you either have today or one that you have in the future, then I've done my job here. So thank you very, very much.